I'm now going to talk about an example that will illustrate the issue between money, mission, and providing the best care for your clients and your patients, and how that plays out. And one of it is when we look at technology and ethics in healthcare. And one of the things you need to keep in mind is that technology really does drive and has become a stronger and stronger driving force in medicine and healthcare in general. And technology includes things like new drugs, new techniques, new devices. So it's not just small things. Also IT, some informatics, all of those things are considered technology, and they are one of the driving forces in healthcare at present. The clinical practice is one of embrace and use all the latest technology to provide better care, which is something you want to do. The problem is that it has advantages, but it also increases the cost of care. So using new drugs means that they're more expensive for your clients and your patients. Using the latest techniques and the latest IT adds a cost to something that's already very expensive. And it's not available to everybody. So those with third-party payment are going to be able to use the newest drugs. Those who are not on that are not going to be able to afford them. Even if you could prescribe them, they can't afford them necessarily. So technology is great, but not everybody can get it, and it sort of creates this two-tiered healthcare system where those that have it and can pay for it and have access to it get it, and then there's everybody else who sort of gets whatever they can get, and that can cause major, major problems. Um, Another sort of driver of this is people keep thinking more technology is better technology, and it causes even more changes. So one example is the internet. Doctors use it for research, it's great. You can look up things. So do patients. So they come in demanding drugs that they may or may not understand or that may or may not be the best for them. They'll also go home and look up their diagnosis. They might come in and doubt you as a physician or a healthcare provider or say you're not providing the best care for them, and they threaten to sue you. So a lot of things are a double-edged sword. And it's not just limited to providers and to use administrators, but also to the general public. It also creates this sort of access, lowering the bar for access. So you can use the internet, physicians, nurse practitioners, health educators can use the internet to connect more with patients to help them achieve outcomes so that they don't go back inpatient in the hospital, so that they can control their diet better if they're diabetic. Telemedicine is part of that too. It's very common in some places. The problem is not all the times is it reimbursed, and some providers get it reimbursed by some insurance companies and some not. So again, that two-tiered system. Usually, unfortunately, it's covered or billed when it is for third-party payers, and those are usually healthier patients than for people who are Medicaid and Medicare. Again, two-tiered system. Those who need it the most may not have the most access to technology. And those are the ethics you have to keep in mind before you decide what you're going to do with the new technology. Not do the new technology and then decide how you respond to it after you've adapted it. That's a very difficult concern. Also, with the internet, the whole issue of privacy. We've talked about HIPAA, how we're not supposed to let other people know about people's health informations. And when you're doing electronic medical records, patients can see them, so you have to be careful what you put in them. But also possibly the concern that maybe the internet could be broken into, as we've seen, and then people have access to other people's medical information. So that whole privacy is a bigger issue too, a bigger concern, ethical concern. Who gets access to the information? What are they using it for? How do we deal with this? As an administrator, one of the parts that you're going to have to deal with is what, just because they build it doesn't mean we have to have it, and can we afford it? How much cost does it add versus a benefit to the patient's care, outcome, quality, daily activities, quality of life? I mean, it's a very difficult decision to determine. We have emerging technologies, nanotechnology, imaging technology, very sophisticated, very splashy and great and wonderful, but who can afford it? How do we decide which one we use? How do we go very systematically deciding that it adds to the patient's outcomes, care, quality of life within the process and after they're no longer patients of ours once they are so-called cured or once they are controlling their chronic illness? These are all questions you have to ask before you adopt the technology, not after, and that means you have to stay abreast of all the latest technology. And there are lots of new technologies all the time. You have to do a cost-benefit analysis. One of the ways to really control this in your own mind is what's the cost, what's the benefit? And you have to do that based on patients, not just based on what it adds to you or, ooh, we have the latest technology, come see us. But how does it impact patients? How can we say that it's worth the cost? And how can we make sure that everyone has access to it that comes through our doors? Again, an ethical decision that's embedded in there, but we don't keep asking ourselves these questions all along. We just take the technology. We cannot do that. As an ethical health administrator, you have to say what value is added and not what value is added to my bottom line, always an issue, but also to my patient and to our community. Does it help the health of the community, which will then help my bottom line? They're very tied together, but sometimes they're about 6 steps apart, and you have to constantly ask yourself these questions. And they're not always easy answers. Also, you have to work with insurance companies, and some will cover things and some won't. So you have to see who is paying for what in your system. What are they paying for? Why are they paying for it? And you have to have a partnership with them. Not a, well, if you have this insurance, you could get it, but you don't, Mr. or Mrs. So-and-so, so you can't. You don't want to be in that position. You want to understand why they're covering it, when they're covering it, and how, and make that part of the treatment plan, not part of you get this, you don't, based on what patients you have coming through the door. These changes will be more constant and more thought-provoking and more that you have to sort of have this built-in guide, gyroscope of how do you respond to the latest, greatest, newest technology. Make sure you understand the real cost, not just the perceived cost when it hits the ground, because that happens too. Oh, this will add to the bottom line in 6 years, everything will be great. What about now? What is the cost year 1, year 2, year 3? Who gets access? Why do they get access? How much are we adding to that patient and that patient experience? You need to have constant access of information about new technology before it comes, once it comes, because you have to really know that it's going to change constantly the way you practice, from the way you build to what's accessible and available to patients. Is it what your patient population needs, or is it sort of just a pretty add-on? Figure that out before you buy it, not after. And you need to make the best decisions based on the most accurate information. So you have to be very proficient in getting information about things, seeing what's out on the land.